It just continues to worsen, and the volume is up. The number of homicides is higher.
Can we get a pelvic condom, please?
If we go a shift without some sort of gunshot wound or some sort of violent injury, it's a rare night.
Adult cold blue.
How difficult is it to treat a gunshot victim?
It's hard.
Some nights, does this feel like a war zone?
And some nights it is a war zone.
Just after midnight at Baltimore's R. Adams Cowley Shock Trauma Center at the University of Maryland. We've just gotten word that a gunshot victim is about to be brought here. As you can see, the medical teams are gathering around this trauma bay. For the doctors and nurses who work here, the shifts seem longer.
I always come in and I wonder, what kind of night is it going to be?
My name is Tom Scalea, and I'm the chief of the Shock Trauma Center. The term I use to describe it is a ballet of organized chaos. And what we are trying to do is identify what is going to kill that patient first and fix it. It's the only freestanding trauma hospital in the United States. It allows all of the practitioners to really concentrate on taking care of badly injured patients.
More often now, those injuries are gunshot wounds.
There's no reason that somebody has to pick up a gun and shoot somebody else. It's not inherent in the United States. It doesn't have to happen. So to me, every one of those is unnecessary and preventable.
I am Heidi Halterman. I'm the charge nurse in the trauma resuscitation unit at Shock Trauma tonight.
Is the gun violence problem getting worse?
Compared to years past, I think definitely yes. It used to be that you'd get maybe 1 or 2 per shift. And now if we go a shift without some sort of gunshot wound or some sort of violent injury, it's a rare night. This isn't an inner city problem. It's everywhere.
It's worse. I mean, it just is. And it feels worse.
Why do you think that is?
I think that there is a great sense of frustration. And people are struggling, and they do not see a way out. I think that this is a root cause problem, and we have not gotten anywhere near the root cause of it.
Honestly, the worst thing that I see is when we have to tell a mom that her young son is dead, and you have to have that conversation with them.
What's your biggest fear?
My biggest worry is just not being able to take care of someone.
Why do you think we're seeing higher levels of this type of violence?
I wish I had the answer to that question.
Why do you do this?
I just do. It's in me.
Every second is critical. You see these doctors and nurses hovering over this trauma bed. They are trying desperately to save this person's life. The beeping right now means there is no heartbeat.
We have another unit of blood.
It's still touch and go right now.
Absolutely. Everybody is just trying to save somebody's life.
It's agonizing as the seconds tick by. It's been about 20 minutes, and there are still about 24 medical professionals hovering over that trauma bay, trying to keep that patient hanging on. You can almost sense some of them are holding their breaths. You can definitely feel the tension here. All as Chaplain Dane Nesmith looks on. How do you bring comfort?
Well, one of the best ways to do it is to be a calming presence. In a lot of these situations, there's no words.
Unfortunately, the patient died. They were not able to resuscitate him.
24 medical professionals here. Sometimes there's nothing you can do. How do you come to terms with that?
Sometimes you save someone. So you do it because there's always a chance.
May he rest in peace, and may those who will mourn his loss be comforted. Amen.
This didn't have to happen.
That is correct. This did not have to happen. But it sure as hell didn't it?
Does this ever get any easier?
No, nothing gets any easier. It gets worse. I mean, this is just freaking nuts. This is one night in one city in the richest country in the world. How can this make any sense?
As a society now, we're seeing more of it. So while it bothers us for a moment, or a few moments or a few months, that fades away more quickly. And you don't have the long-term change that is really needed.
This will be a problem that gets well over a generation, not over a year. This is not a Band-Aid where, we'll just put a whole bunch of people in jail and the problem will go away. The problem's not going to go away. Telling some mama her kid's not coming home. I got to tell you, it gets harder as I get older, not easier. And I've done it more times than I want to remember. And every time I go and do it, I am deeply affected. I speak to them, I hold their hand, they cry, I cry. It's a terrible tragedy.
On your drive home tonight, do you think you'll think about the patient who passed away?
Of course. You always think about them.
It's not just a problem in Baltimore, it's a problem all over the country. And until we as a society decide to tackle it in a serious way, it's not going to get better. And, it's absolutely a public health issue. This is a terrible disease. And it's a disease that we can treat, we can prevent, we can do better at. That's not a political issue. That's a humanitarian issue. It's a public health issue. It's such a crying need that it makes me sad that in the United States of America, this is the best we think we can do.
Thanks for watching our YouTube channel. Follow today's top stories and breaking news by downloading the NBC News app.